I had filler for under eye hollowness, but still look hollow. What can I do?
Hollowness under the eyes is a very common complaint, and treating it with under-eye filler is a relatively popular cosmetic procedure. However, many people who have their under-eye hollowing treated are not satisfied with their results. I've observed that many people who are focused on this particular area of their face miss the forest for the trees and are unaware of other areas which contribute to their hollowed appearance. I'll discuss how I assess the under-eye hollows and related areas to provide my patients with a strategy that will result in them looking their best. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in Manhattan and Long Island for over 20 years. I have extensive experience performing cosmetic eyelid surgery, facelift surgery, and facial implants. I apply this expertise to non-surgical solutions for facial aging every day, particularly in the eye area as well as other parts of the face, such as the cheeks, jawline, chin, brow, forehead, and neck. When I evaluate the eyes, I look at the whole area surrounding the eyes, such as the area where the eyelids meet the cheeks, called the eyelid-cheek junction. In addition, I look at how the cheek appears from the front and from different angles. It's important to recognize that the volume and projection of the cheeks support the eyelid area. If there is hollowness in the eyes and the upper cheek is full, then the cheek blends with the under eye area naturally. This doesn't mean that everyone needs cheek volume, and I do a lot of tear trough and under eye hollow correction without additional cheek filler. Many people will identify the hollowness under the eyes and overlook the importance of cheek volume. If the lower eyelids are hollow with minimal cheek projection, then isolating volume in the under eye area does not blend well with the cheeks and the rest of the face. In this situation, the isolated filler under the eyes adds projection to the under eye area, but then drops off at the cheek, looking unnatural and even baggy in appearance. Filler placement needs to be done so there is balance for the whole face. I typically use a hyaluronic acid filler like Restylane for the tear trough area to fill that hollow space. In some cases, the hollow look may be caused by puffy under-eye bags which project outward, making the area adjacent to it appear hollow in comparison. The fat pocket is like a mountain, making the area next to it appear like a valley. There are limits. For example, if eye bags are too prominent, then surgery is needed to reduce and sculpt the fat pockets. It's important to understand that all under-eye surgery is not the same, and just like the application of fillers, expertise, experience, and the doctor's aesthetic style determines the final outcome and results. If the puffiness is minimal, then filler can effectively camouflage the puffiness by blending the hollowness of the tear trough area with the puffiness above it. If the cheeks are lacking projection and volume, then I offer the patient the option to also address their facial volume. Lack of volume is associated with both genetics and facial aging. The art is to place the fillers in a way that looks natural in relationship to the individual's other facial features. I use a technique called structural volumizing, where I place the filler deeper between the bone and the muscle. By placing the filler at this level, the filler takes the shape of the bone structure. This is in contrast to more traditional filler placement, which is more superficial, which can make the cheeks look too round and lumpy. The procedures are done with a little local anesthetic for comfort and with blunt cannulas instead of needles for safety and to minimize the risk of bruising. Filler placement can take minutes to perform and can be done over lunchtime. Many of our patients return to work immediately since there is minimal swelling. The healing process and recovery time for filler placement is minimal, and since hyaluronic acid naturally exists in the body, the material is slowly metabolized over time. I normally see my patients 2 weeks after filler treatment to see how the filler has settled and if any enhancement may be needed. The ideal filler for this purpose can stand up to the movements of muscle over the bones and is longer lasting. My choice for fillers in the cheek area for structural volumizing is in the Juvederm family, such as Juvederm Ultra Plus and Juvederm Voluma. These fillers work well in this space and can last over 1 year. I do discuss with my patients that fillers do require periodic maintenance and that subtle diminishing of the filler's effect does vary between individuals. It's important to see the face as a whole, rather than just focus on a specific area that needs attention. This area, such as the under eye hollow, can be the focus, but at the same time, it's helpful to take a step back and look at the whole face. Your face conveys so much about who you are and how you feel. Understanding facial balance and harmony with the right strategy can help you put your best face forward. I hope you found this information helpful. Thank you for your question.